Hi, I'm Dr. Liu. I'm one of the pediatricians in the private practice and I practice in SBCC Gleneagles. So I do look after children with both general pediatrics and allergy conditions. So I've been asked and would be happy to answer some of these questions in the Asian parent. Are there foods that trigger allergic symptoms? When should we start introducing allergic foods to babies? There have been many articles about the role of foods and whether they trigger allergic symptoms. In the first 6 months of your child's life, the best and safest food to give your child is breast milk. Infants who are breastfed on average are less likely to suffer from allergies than those receiving standard cow's milk protein infant formula. Exclusive breastfeeding in the first 6 months is highly recommended by all pediatric institutions around the world for allergy prevention. Your baby should only be introduced to new food when he's ready for weaning. I would recommend waiting to introduce solid foods after 4 to 6 months. This is when your baby's gastrointestinal system is able to cope with solid foods. Always start with single foods like single grain rice cereals. To minimize allergic reactions to solid foods, it is generally best to introduce one new food at a time and watch out for any adverse effects. Then you can introduce other single ingredient food like fruits, vegetables, and finally meat. There's no need to deliberately avoid any food. In the past, it was advisable to introduce the introduction of shrimps, peanuts, these more allergic foods, but new research has shown that it has not led to reduced food allergy rates. Instead, in countries adopting this practice, the food allergy rates have risen even faster. That is why in 2008, the American Academy of Pediatrics have withdrawn this statement and recommends that the introduction of solids be done gradually. What are some common allergic symptoms? How can I tell if my child has an allergy? What symptoms do I look out for? Common food allergic symptoms include rashes like hives and eczema, which often occur within the day of ingesting the food. An important point to note is that while eczema is present in 10 to 20% of Singaporean children, only 20 to 30% of babies with more severe eczema will have a food allergy or trigger. Eczema is primarily a dry skin disease, and most children with eczema do not have food allergies. Other common allergic symptoms include eye swelling or lip swelling, vomiting, fresh blood in stools, or acute breathlessness like wheezing. Food allergies can be recognized easily as they are closely related to the timing of food ingestion and reproducible each time the food is ingested. On the other hand, respiratory allergy symptoms like recurrent rhinitis and wheezing are often triggered by infections and may be due to house dust mite allergy. If you have concerns regarding your symptoms, discuss them with your doctor if an allergy test or consult is beneficial. A simple and proven allergy test is a skin prick test, which can diagnose common food and environmental allergies easily and is well tolerated. I hope this has been useful. If you have any queries, please fill in your comments below.